but I think it's just like one step and then
We are live.
Welcome everybody to our regularly scheduled DSS meeting. Just a reminder to all of those in attendance, please silence your mobile devices. Not silence. And I'll ask Commissioner Pittman to lead us in the invocation.
Dear Heavenly Father, thank you for the opportunity to come out and serve the county, God, in this capacity, God. Thanks for everyone that's represented here today. Be with us, guide our decisions, God. Help us to help those in the most need. We ask this prayer in Jesus' name. Amen.
And we'll ask our director to lead us in the pledge.
Attention, salute, pledge. I pledge allegiance
to the flag of the United States and to the republic which stands one nation under God, indivisible, with liberty and justice for all. Before, missing the note.
Yeah, I haven't got anything from him. He's supposed to be here today.
I guess we can continue without it.
Yeah.
Okay. All right. Yes, sounds good. I think it's pretty straightforward. Item number 5 is the ethics awareness and conflict of interest reminder. Having the opportunity to familiarize yourself with that now. Are there any ethics or potential conflicts of interest that need to be disclosed at this time? Hearing none, item number 6 is additions or changes to the agenda. Are there any additions or changes to the agenda that need to be made tonight? Hearing none, I entertain a motion that we adopt the agenda. So moved.
Second.
All those in favor, vote by usual sign. Motion carries. Item number 8 is the approval of the minutes. And I believe that Taylor sent out a little updated minutes this afternoon. Did you guys have an opportunity to look those over, or do we need to table those until the next meeting?
Yeah, just table.
You want to table? I think they were sent out late. There was a mistake that we noticed, and she sent a revised version, but we'll. So the motion table there, Commissioner Masters.
Yes, please.
Is there a second? Second. All those in favor, vote by usual sign. We'll table the approval of the minutes until for the next meeting. Item number 9 is the director's updates. And we'll ask our director to come and give us her update.
Good evening and Happy New Year.
Happy New Year.
2024, it's hard to believe. So as we expected, December was going to be a pretty busy month, which it was definitely, with Medicaid expansion rolling out. And I am pleased to say also with expansion, we have hired for that position. So they actually started today. So we're looking forward to that new role, and the position is actually bilingual and has had a lot of community involvement in other agencies. So we think that's going to be a really great fit. We also have been very busy with our LEAP and our CIP. LEAP rolled out, opening it up to the community as a whole, and not just our elderly population. So it's kind of booming right now, especially with this cold weather. So the girls are very busy. I wanted to let you know that our next MDT team meeting and our law enforcement meeting is the 9th of January. We also held our foster parent gathering, our Christmas dinner with them, and we had about 60 to 65 people there. So a lot of fun, a lot of kids running around, showing entertain them with games and, a lot of fun. And it was really nice to see the foster parents together and communicating, sharing, I mean, that sort of thing. It was a great event. And also on my agenda, I just wanted to kind of put it out there as far as, since we're going to a new year, looking at the DSS agenda as a whole to see if there's anything that we would like to change, add, remove. I just kind of wanted to bring that up for discussion tonight. I know that typically, each month we are reporting these subsidy numbers. And with us contracting that now with, Southeastern, they're a little bit delayed in getting us those numbers, so they're not as accurate as what we could do each month. So we could continue to monitor those and maybe even change it to every 3 months report those, or we could move those as a whole, or so kind of want to put that item up initially.
What was the other service that we contracted out besides subsidy?
The ARC,
Or,
that is for our guardianship, yes.
how's that going?
So far, so good. Not aware of any issues. And they're serving 5? Yes, 5. So as far as our subsidy numbers, would we be okay with reporting those quarterly or?
I mean, it appears that's gonna give us more accurate numbers. Does our consumers seem to be pretty, pleased with the contractor and it's doing that?
Yes, as far as I know, and like I said, we're still maintaining contact with them, especially as a part, I serve on the Smart Start board. And so I'm also able to monitor that on that side of it, as well as like our Smart Start dollars and all of that. So as far as I know, I haven't heard of any complaints, and I hope no one else has, and if so, please let me know.
Y'all, is everybody okay with subsidy numbers being quarterly?
Yeah.
Okay.
Okay. The
Well-
other, oh, go ahead.
And I guess we've talked about, the presentation of the agenda. If there's something that you guys would like to see different, if you just want to let me know, I think we'll do whatever you guys want to do for the agenda. If you need to see something different.
And the work first numbers, we also report those monthly. So, I was curious, are you still happy with those numbers? Because it doesn't change too often. And we're allotted a certain amount of money to serve, families. And I just wanted to know if you would like those to continue to be reported as well. So, I don't know, Tammy, do you have anything else?
Well, we are putting in our work for plan that we, emergency assistance, that we budgeted 30,000 every year. So we give out that same amount every year. So it could be, the cases numbers could fluctuate, but the dollar amount is always gonna be 30,000, and then we're done for that fiscal year.
So work first is a subsidy for folks that don't qualify for the subsidy.
No, Work First is an entirely different program. It's very complex. There's like 5 different programs under Work First. And we had actually talked about doing a presentation for Work First. So that's something that we could definitely get on the books before we make a decision about this, but, it really kind of gives that parent help, just a leg up, on some things. It can help with, subsidy. It can be like emergency assistance.
Is it for parents that don't really fall within the guidelines of Medicaid, that are kind of in the middle, or?
No, I don't know, Sean, you supervise Work First.
Yeah, it's.
It's so complex.
The program is so complex that it just, like when you were saying, there's several programs under it. One is, child only, which a lot of our like relatives who have kids placed with them, they can access business through that. There's actually employment services, which means if someone has a job, and they need certain equipment for that job, let's say they became a CNA and they needed uniforms and they didn't have it, or their car needed new tires in order for them to get back and forth to work. That program could actually help you know,
Is-
put tires on a vehicle.
Is there poverty guidelines that, like a company work for, or is it just discretional, or?
I mean, there's guidelines
Eligibility,
as to,
yeah.
yeah, there's guidelines as to who qualifies, it's based upon income, it's based upon all those federal requirements, basically. You know, someone apply for food stamps and Medicaid, it's all geared towards, you know, the number of people in your household, what's your income, assets, all that kind of stuff has to be taken into account for each of those. Different programs, but each of them have different rules, different allotted supports and things like that.
Sounds like-
Jennifer Garland is the supervisor of that program now. It shifted.
Okay. Sounds like it might be good for us to
Have a presentation.
Absolutely.
Okay.
We make a decision.
Sounds good. Sounds great. And then the last thing I was curious about with our numbers that we report to you is the kinship homes. Now with those being included, would you like that kind of separated out so you can see what homes we are paying for kinship care? Because, you know, in September, we had to put that in place, so we start paying them.
It's not the same rate that it is as your traditional foster care. It's what half.
So would you like that? We want to capture that, but we don't really want it, you know, meshed in with our other numbers, so we thought we could pull that out.
Yeah, I think it'd be very
Yeah,
helpful.
okay. All right, so we'll make those changes.
And will that show the number of kids that, let's say there was one particular home, and that home has 3
Mhm.
in kinship placement or 3 siblings, it would show there are 3 siblings or 3 children there at
It should,
this amount
yes.
of money.
Yeah, and we can work on that with Camille. She asked me today, you know, like how we want to start doing that. So, yeah, I think we can hopefully make it individual, yeah.
And there's not a set amount of money that maxes out in kinship, is there? It's just-
It really depends on the age of that child. It's broke down into age ranges, and whatever age range that is what that parent is paid.
But the
So it
state doesn't
changes.
set a maximum dollar number, like $100,000, and when your 100,000 is gone. No, it's okay,
It's okay.
it's us.
Yeah,
It's basically just, you know, half the rate, right,
Correct.
of what your traditional foster care homes would get.
currently, I want to say, how many we have?
We have 3 right now,
Yeah,
3
I was
homes
gonna
that we
say
paid out for the first
Prior,
year.
prior to September, you know, the kinship
We
placement.
were not doing that.
Let me ask you this, have you seen an increase in kinship placement? Or had more interest in kinship placement with children since they were receiving a little bit of money to help out?
No, I mean, it rolled out on November 16th was when it actually took place. I think we've only had one child come into custody since then. I don't think that it's gonna be, we've never had an issue where a parent, we went to a care, you know, a relative or kinship and they say, we're not gonna do it because we can't afford it. It's, if they can't do it, it's because of health issues, it's because of other issues, it's never been financial. For us, I don't think it's going to increase that, but what it does is it provides those individuals who are willing to take on
It definitely
that
has
extra,
grandparents that are.
you know, that they have some now assistance with that where we couldn't provide that before.
Definitely, and we always look to that first. If there's a kinship, we always want to go that way. For sure.
Sometimes kinships result in getting in place out of county because the kinships are out of county.
Yeah.
But,
Yeah.
I mean, I guess when push comes to shove, you would, the priority would be kinship over the county.
And these folks don't have to go through the foster care training classes, correct?
Correct. So it's just, as long as they meet the state requirement, of what a kinship is, and the state set what that is. As long as they meet that criteria, then they automatically get it.
5th degree or
Yeah,
something.
within 5 degrees and so.
There's a little eligibility packet that the social workers fill out to ensure that they're eligible. And that stays on file before they get a license. They get a pseudo license number in order for us to draw down reimbursement. So there's a little bit of a process there to make sure that eligibility is documented.
we'll start looking at that and finding a way to show that on the monthly numbers too. And if you think of anything else that you feel like you would like more attention to, or something that we haven't thought of, thinking outside the box, it's a new year. So moving forward, we can shake things up a little bit if need be. So we're open to that, whatever you guys need from us. Okay.
Any questions for Wendy? Thank you, Wendy. Mr. Shaw?
Good evening.
Good evening.
Not really a lot of changes. We still have 38 kids in custody as of December. End of December. We did have one new case come in and one case closed, so we ended up with still being at 38, although we did have a kid, the young lady aged out during the month. We still have 6 kids cleared for adoption. We still have one of those, it's not included in this number, but because they're not technically cleared yet, we still have a kid who's pending an appeal on that. We did have one of our 18 to 21-year-olds aged out of, they turned 22, so they dropped off as well of the 18 to 21 program. So we only have 2 kids, young people in that program at this time. Our out of county number it continues to drop. So we're down to 19 kids that are out of county. Most of those are in specialized placements.
A lot of those kids are aging out of the 2000.
And a lot of those are in that kind of some of those older kids that we have in custody as well. We have three families currently in the licensing process. We have 11 current homes. We're down from 12 homes. One of our homes who has continued to stay open. They adopted a while back, and so they weren't going to necessarily foster anymore. And so they've basically she does some training for us. She helps out as one of our trainers, our foster parent representatives and stuff like that. But she has chosen to just focus on being an adopted mother. And so she's not going to foster anymore. So that's why we're down to 11 there. Number of reports that came in for December was 10 for APS. For CPS. Screened in 5 of those. At the end of the month, we had 11 open cases that we were working. So they've been staying pretty busy. As you can see, pretty much averaging throughout the entire year, having about 13.5 open cases each month working those cases. So they're staying quite busy. We have 4 open in-home cases at this time as well. So that's the CPS numbers. For APS, we received 6 reports. Out of those 6 reports, 5 of those were screened in. We had service intake. We didn't have any service intake, but we did service. We had 6 service requests. Basically, what that is individuals calling for information about services. They're not making a report, but they may say, "Hey, I've got a mom. I need this information. I'm trying to connect with these services." So we help just connect individuals in the community with information and phone and contact numbers and stuff like that. So we service 6 families with that. Open assessments for APS, we had 3 at the end of the month. We have 3 in case management services at the end of the month. And then ongoing services like special assistance in home. We have 2. We've stayed 2 all year. Representative payee 12. So with guardianship, we're still covering 13 cases, while we have about 5 cases that are being done with the contract. We did have several facility reports, complaints that came in. We had 3, plus we had some that were left over from last month. So we still were dealing with 5 complaints, going through those. Those are very involved. And you can be working one complaint and get another complaint, and you gotta start from scratch. You can't just roll that into your existing complaint. You have to treat each complaint individually and work it, although you may already have one. And you're working in it, you have to work them all separate, so that's a lot of workload there, but.
And so what is the process of you, in that situation, you find neglect?
It depends on what type of violation. It could be a technical violation. And so it's basically providing the provider, with a corrective action, and giving them some, then follow back up. Did they follow through with that corrective action? We got to report stuff to the state as well. And so it's basically just working with the facility to address the concern.
Okay.
And then, for the child subsidy, 82 kids being served. We've been averaging that pretty much all year, 82.7. And then with Work First, we had 13 applicants, that came in December, and, serving ongoing, child only cases was 5. Different questions?
Any other questions for Sean?
One thing I want to point out really quick is if you look at the children placed out of county and the children placed in county, Camille brought to my attention, 19 and 19. She said that is rarely ever happened, that we've had the same amount out of county that we did in county. I thought that was interesting.
Sandy?
Hello, happy new year. Missed you guys last meeting, I was in Seattle.
Welcome back.
So, yeah, I'm back. I just have a real short report, even though it's inclusive of the last 2 months for you. We are 6 months in on our expenses and should be about 50%. So we're right at 49, so we're just hitting right on target. Not a lot of room, but not over yet. And hopefully won't go there. A couple of our accounts we're watching real closely, obviously, is the overtime costs. We've talked a lot about that. We're hovering at 88%. We're trying to hold it there. So we're trying to really staff good and watch that overtime cost. As well as our guardianship account is hitting at 99%. We're still trying to recoup some monies back from some of those cases in order to get that down. I'm gonna watch it the next couple of months. If we can't do it, we'll have to have a discussion around that piece. Let's see what else. Our subsistence is at 90%. That's account 3120. That's just due to our East Coast visits and having to send some of the workers over there. That's as far as the expenses go. I think that's the major flags that we're watching. Revenues, we're at 29%. We should be about 33% at 4 months, but we have unposted revenue of 212K sitting there ready to be posted or has been posted this month, and we'll see that catch up next month. So other than that, nothing major to report on the finances. If you have any questions, I'm happy to. It's good to see you.
Welcome back. Good to see you. So, any questions for Andy? Is there I don't believe there's a need for a closed session on that. Board comments, Commissioner Harding?
Sounds like we're getting up to a great, year with a lot of work. Here's for you guys to start with. So, hope all of you and your family have a safe and happy holiday, and wish you the best in the upcoming new year.
Ross? Welcome. Mr. Masters?
No comment,
And, I don't think I have a comment tonight either, other than thank y'all for your continued work. I entertain a motion, we adjourn. For a second. Second. Harley, right?
Yeah.
Yeah.